What's up, and welcome to episode 61 of the unofficial NCLEX podcast. I'm your host, Katie Kleber. Today's episode is entitled Provide Instruction and Information to Patients About Body Positions That Eliminate Potential for Repetitive Stress Injuries. So essentially what they're talking about is things like maybe carpal tunnel with typing or back injuries. Those kinds of things are common but preventable. So we want to educate our patients appropriately so they don't find themselves in a situation where they need a surgery that could have been prevented. So things to encourage are proper body mechanics and not treating pain, just treating the pain when it occurs. We want to address why this problem is occurring in the first place. What can we do to avoid it? What additional exercises and whatnot can we do to prevent this? This is really going to take working with a physician and maybe a physical therapist or whomever they deem appropriate to best address this situation and get the appropriate support and maybe physical therapy, exercises, or, hey, if they're bending over, we got to make sure that, bending over a computer screen, that they're using maybe proper posture. They have maybe one of those things that kind of elevates the wrist while they're typing so that alleviates some stress, that they know to take breaks, that they know how important that stuff is and it can result in injury. We don't just want to do this very unhealthy, consistent, repetitive motion. Just treat the pain and continue doing it, because we're just going to continue to have pain. It's going to continue to get worse. We're not solving any problems. We're merely putting a mask on the symptoms until they get to a point where we need a bigger mask and a bigger mask, and then we get to a point where it doesn't help, and then we need a much more serious intervention like surgery. So the goal is to prevent that stuff to get that bad in the first place. And this really is going to take working within the healthcare team to provide that optimal, customized care plan for that patient based on maybe their job. And a lot of these repetitive stress injuries are really frequently related to some sort of occupation. Whether it's typing or maybe construction or specifically working with your hands in a very repetitive manner. We've got and typically you can't avoid that specific action, but we can enable some supportive devices. We can use proper body mechanics and maybe some exercises outside. But the important thing as the nurse is to educate and make sure that they know that this is an issue. We've got to make sure that, if we're observing them doing something like maybe walking really hunched over or sitting, really, with really poor posture, and that may cause stress on maybe their neck or something like that, that we are, eliminating that eliminating that, educating them on how big of a deal it is so that they can eliminate that and take that within their own power and do that. So it's really important. So again, the title of this episode, Provide Instruction and Information to Patients About Body Positions That Eliminate Potential for Repetitive Stress Injuries.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.